the lower part, right? From each one of those three bones, there are ligaments that originate here and insert in the femur. So we have an iliofemoral ligament, pubofemoral ligament, and ischiofemoral ligament. Okay? If you think of the three names of the three bones that make up the coxal bone, those ligaments should be easier to remember. And out of those three, the most important one is the iliofemoral ligament that gives more stability to that joint. Okay? All right. So in terms of movement, again, this is flexion. Okay? The major flexor of the hip joint, we said that is the iliopsoas. Okay? What are the extensors of the hip? The gluteal muscles, all of the gluteal muscles, so gluteus maximus, gluteus medius are also extensors. Okay? The other movements are medial rotation, lateral rotation. So both medial and lateral rotation are done by the tensor fascia lata, that is here. Okay? Abduction also, the tensor fascia lata can also abduct the thigh. And what about adduction? Which muscles will abduct the thigh? The adductor muscles, which are four actually. Pectineus, this little muscle here, adductor longus, gracilis, and adductor magnus. Okay, so we're done with the hip joint. All right. Okay. Now let's move on to the next large joint in the body, and let's review the anatomy of the hip joint. First of all, what kind of joint is it? Synarthrosis, amphiarthrosis, or diarthrosis? Little movement, slight movement, or a wide range of movement? Wide range of movement, okay? All synovial joints are synarthrosis. All synovial joints have a wide range of movement. In other words, all the joints of the lower limb, the big ones, are synarthrosis. I'm sorry, diarthrosis, meaning that they have a large amount of movement, okay? And all of them are synovial, okay? All of them are synovial, all of them are diarthrosis. Okay, what are the articular surfaces in the knee joint? The bones that interact here. Which bone is this?
Femur.
The femur, right? And the tibia, right? You see that there is no actual articulation between the femur and the fibula. So the fibula doesn't really participate much in the knee joint, right? Just the femur and tibia. But in the knee joint, we also have to keep in mind this little bone. Which one is this? The patella. So we can say that in the knee joint, we actually have two joints in one. The femoropatellar joint and the femoral tibial joint, okay? Or tibiofemoral, whichever way you want to call it. Okay. What makes this joint stable? Yes, basically all of this joint. We also have a capsule. Hi.
We're going to take a half-hour break. If
You
want
will.
to steal some lessons for a half hour.
Oh, okay.
Feel free.
All
Because
right.
I'm going to go into the trunk now.
Oh, okay. Great.
So I'll
Okay.
go to the trunk.
Thank you,
second
Jean.
half, sure.
Okay. So, but do we have a capsule in the knee joint? Yes or not?
Yes.
Yes.
Yeah.
Okay. All of these big joints
Synovial joint.
have a capsule. Okay. They all have a capsule. A capsule is basically a structure formed by fibrous tissue. Okay. So we have it in the hip. We also have it in the knee joint. Okay. And we also have ligaments. So let's think of the ligaments that we have in the knee joint.
With the ACL.
Exactly. So
PCL.
there are two sets of ligaments. Some that are intracapsular, so inside the capsule, and some that are outside the capsule. Those that are inside the capsule are